Duane syndrome type 1 is the most common of the retraction syndromes. The differential diagnosis between sixth nerve palsy and Duane syndrome type 1, where in both there is a limitation of abduction, is not difficult in older children. However, in young children and especially infants, Duane syndrome is easily mistaken for a sixth nerve palsy. The consequences of this error are not negligible, because the surgical treatment of sixth nerve palsy would be contraindicated in Duane syndrome. The clinical picture of Duane syndrome is limited abduction, widening of the palpebral fissure on abduction, narrowing of the palpebral fissure on adduction, retraction on adduction, up or down shoot on adduction. Sometimes Duane syndrome type 1 is associated with esotropia. In Duane syndrome type 1, the head turn is to the involved side. Duane syndrome type 1 has 4 differential diagnoses. Sixth nerve palsy, where there is limitation of abduction. In cases of tight medial rectus, after previous resection, this will limit the abduction. Pseudo-Duane syndrome occurs in conjunctival scarring involving the temporal aspect of the globe, as occurs after repeated strabismus surgeries. It also occurs after repeated surgeries for pterygium or after removal of a conjunctival lesion. This girl who has had repeated strabismus surgeries leading to this narrowing during adduction. This is called pseudo-Duane syndrome. In infants who have essential infantile esotropia, retraction of the globe, narrowing of the lid fissure on adduction, and widening on abduction are signs that may be difficult to detect in esotropic infants. Limitation of abduction and closed fixation are frequently present in essential infantile esotropia, a condition that must be differentiated from Duane syndrome type 1. Before discussing the surgical treatment of Duane syndrome, you have to know, although numerous surgical approaches have been advocated to improve abduction in eyes with Duane syndrome type 1, success is limited. Most attempts to improve abduction by surgery on the involved eye result in increased retraction of the globe on adduction. Indications for surgical treatment of Duane syndrome type 1. Firstly, the presence of esotropia in the primary position. An esotropia in the primary position causes uncrossed diplopia with a compensatory head turn towards the involved side. A recession of the medial rectus improves the head position, but at the same time may cause limitation of adduction. Esotropia in the primary position is treated by medial rectus recession. Also, the presence of head turn is treated by medial rectus recession. In cases of up or down shooting on adduction, the surgery is lateral rectus Y splitting. In the presence of disfiguring narrowing on adduction, the treatment is medial rectus and lateral rectus recession.